So today I wanted to share with you what it's like to be as a theatre veterinary nurse. In my practice we share the roles kennels, pharmacy and theatre nurse. So when we get in as theatre nurse, we like to turn on all the oxygen just in case an emergency patient turns up, making sure the breathing circuits are on, they've been tested and leak proofed. And then I turn on the heater and the heat pads in theatre to make sure it's cosy warm so that our patients are nice and toasty when they wake up, which aids recovery. I also damp dust all the sides by wiping them all down just to make sure it's all nice and clean, and checking through the emergency kit that we've got everything in there that should be and nothing's missing just in case. I also set up all of the other equipment in theatre, so the ECG leads, the blood pressure, pulse oximeter. Getting the leads, I put them in a weird way so that when I move a patient through into theatre, I can easily connect them because I know where all the leads are, rather than walking in there and they're all tangled up. So I have a certain way of doing them. I also turn the machine on, and in a little while I sort it all out, putting in the correct details for the species and the blood pressure cuff size I'll be using. I also make sure that the kits are ready for each of the procedures in the day so that we can just move swiftly on from one and then the next. And then here I am setting up the breathing circuit in theatre. So I'm attaching on the absorber there because the patient's over 10 kilograms, so it's done by weight. And I'm also putting on the reservoir bag and testing that out again for any leaks or anything that I should be concerned about. Here I am setting up the fluid bag. So we always supply fluids to our patients that are receiving an anaesthetic. And soon I will pop that onto the fluid hanger behind me and I'll connect that to the fluid pump. I usually also try and get the fluid pump set up on the surgical rate for the patient I'm having in. So I do 5 times body weight for dogs and 3 times body weight for cats. And I like to make sure everything's set up so it just makes the transition from patient into prep after surgical preparation into theatre as smooth and easy as possible so that I can connect everything and just continue monitoring my anaesthetic. So here I am setting up the bear hugger. This is just an additional heat aid to help our patients throughout their operation. Theatre nurse will then admit all of the patients for the day. So this is our cat castrate. And this one is our bitch spay that you'll see a little bit later on today as well. So here we are, me and my colleague are pre-medding intramuscularly using ACP and methadone, and then in a second we use Rimadyl as a non-steroidal anti-inflammatory medication to provide pain relief, and that's subcutaneously, so under the skin layer. And here my colleague is placing an IV catheter into our bitch spay. She does an amazing job, bless her, but she is a very wiggly girl. So I try all my best efforts to try and keep her nice and calm. But in a minute you'll see that she does like to wiggle around quite a bit and likes to try and chomp on everything. But here you can see in a moment, you'll also see my colleague placing another catheter into another dog, which I'll go into a little bit more depth about the process as well. But I thought this moment was quite golden in the fact that she did not like us to be doing this. She was very good, but very, very wiggly.
Okay. Yeah, it's nice. Ooh. Oh no, don't eat that. No.
Lottie, wait. Sit.
Stay.
Sit.
Good girl.
Sit.
Stay.
Sit.
Not long. Oh, it's orange and no.
No, stay. Wait. Girl.
Well done.
She's very concerned about the orange pandas, isn't she?
Because how is it? Is that normal?
Okay, but you can't put that on there. No!
So the vet that will be operating in the day makes sure that all of the animals are suitable for the day's surgery, so we'll just do a general TPR, and if they're in for a neutering, we'll make sure that they're not in season and they have their testicles descended and things like that, basically. So that was a bit of the preparation for the cat castrate. She was providing lidocaine in there to help numb the area. So we sedate the cats instead of giving a general anaesthetic, just to be a bit kinder, and it also helps in terms of their recovery as well because they come around a little bit quicker. We also microchip him whilst he's under, and that's during his recovery. So after that, we make sure that theatre's definitely all prepared, and we get our bitch spay nice and sleepy by providing propofol IV. And once she's under, we pass through an ET tube or an endotracheal tube down her throat to aid breathing while she's under. It also allows us to control her breathing. My colleague here is now clipping the surgical site, and then she'll begin scrubbing it. We do a chloroprep as well in theatre once we've moved her through, so this is in theatre now. This is the monitoring equipment that we use. And here's a good point for me to say, avert your eyes if you're a bit squeamish. So what we see is very interesting, I think. And that is honestly the end of all of the grossness, so don't worry about averting your eyes if you're a bit squeamish now. There shouldn't be any more of that. But you can see on there the blood pressure is not showing, so that's all the green bit. It says cuff type error, which was a bit annoying throughout, but we eventually got it back up and running. I can't actually remember the exact reason why it wasn't working. Sometimes it's loose, sometimes you've got the wrong cuff, sometimes the lead isn't exactly on and working properly. And this is her during recovery. Very, very sweet girl, wagging her tail, and recovered very nicely. And this is our dog castrate. He came in quite nervous, but really did like a cuddle. And as I said earlier, this is my colleague again, placing another catheter, which I'll break down a little bit more with you. So she clips the site, she does a Hibby scrub and a spirit scrub, just to make sure the area is nice and clean. We're using a 20 gauge catheter, so quite a large catheter for him. It just provides easy vein access in the event of an emergency, but also provides fluids throughout. So she's taping that in. She waits for the blood to come back, which we called flashback, so she can see that, which she knows she's in the vein, and then she can advance it. She's just switching over the temporary bung for the injection cap, and she's securing that in place with the tape. I'm passing her the tape just to make it a little bit easier as well for her. And then she uses some saline just to flush it through and check that it's definitely in, and the nurse will put her thumb over like she just did to feel for the fluid underneath the skin, just to ensure it's definitely in. This is a padding layer that we use just to make it a little bit cushiony for them, makes it a little bit more comfortable. And then a vet wrap layer. She uses this one here just as a provision, just to prevent any eating or chewing of the bandage there. So this one tastes a bit gross, so that's why it looks a little bit different from the one earlier. And we ended up putting it on the bitch spay anyway because she tried to chew it, so it just prevents them wanting, or at least attempting, to try and chew out their catheter, which is the least of what we'd like, because we then would have to place another one. And then we induce him and we place an ET tube, and that's just the process of that. And she'll squeeze the chest just to provide a breath for her to check to make sure it's in. And then after scrubbing the surgical site, we move through into theatre. So that's just spraying onto the ECG leads to help connection to the skin layer. And that's the chloroprep scrub that we do in theatre, as I was talking about earlier. And just a little bit about handing over some sterile material to the veterinary surgeon. After that, we clean the instruments and we tidy up everything else. So we have a little plan of action of what we're going on. So once that's all done, we can begin cleaning, changing over oxygen, turning oxygen off, topping up the SIVO, which is the anaesthetic gas, and also caring for the patients that we have in for the day. Once they've been cared for, they've eaten, they've had a walk, and they're up and upright, a little bit less sleepy than they were. Sometimes they do generally go home a little bit more sleepy. It does take up to 48 hours for the anaesthetic to fully wear out of their system. But after this point, once they're still in our care, we take out their IV catheters and we put up a little pressure bandage just to cover the area and prevent any bleeding. I like to put on a little tab, as you can see, just for easy access to remove that once we do let them out. So we try and take them off before they go out to their owners. And I update the board as regularly as I can. And then she goes home. A very happy girl, bless her.